43 years old. I have 3 children. We own a business in Bossier, pharmacy. And so I'm a very busy person. So I lived with a lot of pain for a long time because I was too busy, and I was busy taking care of everyone else. But it finally got to a point where I had to do something about it. So I went to see Dr. Googe.
And how did you find Dr. Googe?
He was actually recommended to me from another doctor. And then, of course, I've been in the medical field for over 20 years, so I always ask everybody I know. And he came highly recommended. So, and they've been right.
Okay. So you found him. When did you start your process? So let's talk about timeline.
Dr. Googe has been my doctor for about 3 years. I originally started coming to him because of hip and knee pain, because I have arthritis in both of my knees also, but it's minor compared to what was going on with my hip. And after seeing him about a year, and we treated it with Kenalog injections through the pain consultants, Dr. Majors and Dr. Nelson over there, and they would help. But they would only last for about a month, and as time wore on, then I started oral pain medication and would still have the injections, but the injections got to be where they lasted less and less time. Then in April of 2011, I had an arthroscopic hip surgery where Dr. Googe went in to repair the tears that had been caused by my hip bone, because there was a part of my bone that was actually, it was a congenital defect that I was born with, and even he didn't realize the severity of it until he got in there. But he repaired all of the tears and shaved off part of that bone, and so that recovery was about a month or so. And I went on, and as I started to get a little bit better, and then I started to kind of, nosedive a little bit, and it just kept getting worse. He decided to get another MRI, and at that time he saw that arthritis that was in there had just, in the 6 months after that surgery, it had gotten worse to the point that it was just progressing and getting very, very painful. And unfortunately, like you said, because of the things that I've had going on with my hip, sometimes that just happens. No one really knows the precise reason why, but it's just an unfortunate thing that happens with some people. So I got a couple more injections out of leave and changed my pain medicine. And that was, I think, for me, was the catalyst, was the changing of the pain medicine, because we do own a pharmacy and medical supply. I've seen a lot of patients that come through there that have to rely quite heavily on pain medication. And I didn't want that to be me. So when we went up, to an oxycodone, I got this little flutter in my heart, and it kind of scared me. So that was my catalyst to say, okay, I guess it's time to go ahead and replace this hip. So I timed it during spring break, when my kids were out of school, and I wanted to do it before the summer because I wanted to have my life back. So that's kind of how I wound up there.
Okay. So you scheduled surgery with Dr. Googe, and where did you end up? Tell us about your hospital experience at Specialist Hospital Shreveport, how you chose this hospital.
Okay.
I mean, because you have an option to go anywhere.
Right.
Dr. Googe has operating rights at other places. So, so how'd you pick us?
Well, a couple of things. Number one, I've been to every other hospital, either with a family member or something I've had, and I don't want to speak badly about those hospitals in any way, because that's not why I'm here. But I wanted to give specialist hospitals a try for a couple of reasons. One, I knew that it was here, closely located to Dr. Googe, and I liked knowing that he was basically just downstairs. So that really appealed to me. It appealed to me that it was easy to access from where I live, because it's right off the interstate in effect, so that my family would be able to get here quickly, and back and forth. Also, I asked around, and other people had had good experiences there. And again, I had had some exposure to the staff and that sort of thing, going through the pain consultants because I had to have those injections that I mentioned had to be done under the fluoroscopic, so I actually had to kind of be admitted, you know, every time. And I wanted to try it, so I arrived that morning. My husband brought me, and we had some friends and family waiting for me, and they took me back in the room, and everybody was very kind and started my IV. Put my, you know, put the clothes up and all that, and once they started my IV to sedate me, everybody kind of kissed me goodbye, and they went to the waiting room, and I got wheeled into the operating room. And it was actually kind of funny because I knew so many people from the past, and the nurse anesthetist, actually I had worked with at a hospital, so I got tickled to see him in there. And the last thing I remember is I made a joke and said, I hope none of you drank too much coffee this morning. And they all kind of laughed, and that's the last thing I remember until I woke up. But I woke up. I forgot to mention I did visit with the anesthesiologist before because he came to visit with me. Everybody asks you your date of birth and your name, so you have to repeat that about 20 million times, which is a good thing. But anyhow, when I woke up, the anesthesiologist came to make sure I was all right. And I don't know if he's just really, really special and magic in his magic drugs, but that was the best wake-up experience I've ever had waking up. I wasn't my usual groggy where you don't know what's going on, who are these people. It was just very strange because I had a clarity that I never experienced before. Everyone came and checked on me, of course, and we went to the room. And now the hospital itself was like pristine and clean. It was crazy clean, and it was nice. It felt updated and what have you. The nurses were right there on the spot. Everyone was very kind, very knowledgeable. They got me into bed. I had a pain pump. When I first woke up, it was a little bit more stiff. I guess I thought, I don't know what I thought, but it was painful, but wasn't quite as painful as I thought it was going to be. But little did I know that was from a little magic morphine pump. But needless to say, it wasn't as bad as I thought. Now, it was painful, which one would expect, having a hip replacement. And then when I got to the room, I had to use the restroom, and I thought, surely they would categorize me because I just came back. You know, I'd heard they get you up right away, and they did. I got right up out of bed, and that, to me, it was painful. I'm not going to lie. It was painful, but it was bearable. They were very helpful, very cautious. They were telling me information. They're constantly reminding you how to put your leg out in front of you before you stand up because you have a risk of dislocating it if you move in the wrong way. But they're constantly there reminding you, do this, because you can hear it and you can think it, but your body is so accustomed to moving a certain way. You really have to take your time and think about, what do I want my body to do? Otherwise, it's just going to react as it normally has, and you can get in trouble that way. But they're always right there telling you. And they got me up to the restroom, and that was an experience. But I think what I was saying was the amazing thing was I could walk on it. That was just crazy to me because I just had it replaced, and I just immediately I could put weight on it and walk. And that was really crazy. But I went to the restroom slowly, and they got me back in the bed. But they were, all the nurses and the aides and everyone, as they changed shifts, you know, they would introduce themselves and what have you. But they were always in and out, checking on me. There wasn't a whole lot of time where they weren't, especially those first couple, you know, hours, and then actually that first entire day. Then therapy came in soon, and I got up to actually walk, and I just wanted to be the macho woman because I wanted to heal fast, and so I would try to walk further than they would expect me. One of the therapists that stands out in my mind is Sam. He was very, very friendly, very knowledgeable, very personable, so I can tell I'm mentioning him by name because I really liked him.
He just left.
Oh, I hate that.
He does part-time sometimes, so.
He's a great guy, though.
Mhm.
Really
Mhm,
great.
he is.
Really big asset.
Mhm.
But all the nurses and the aides, and I just thought surely I would remember everyone's name. I should have written it down. I wish I could remember all their names because they were all very, very just knowledgeable, tremendous, patient, kind, very compassionate. I never felt like I was just a piece of meat in the bed. I never thought that I was just something they had to deal with because they were there. I felt personally connected to all of them, and that's how they make you feel. And I think I mentioned to you before, the one thing that, not the one thing, but a major thing to me was when I rang that bell because I needed to go to the bathroom, or actually, even if I needed pain medicine after I came off the pump, either one, but especially going to the bathroom, I never ever had to wait, never. And I don't think I even waited 5 minutes any time, and that's a tremendous thing for anyone when you have to have help, but especially after a hip replacement, which is very painful, and it's a slow moving to the toilet. They never made you wait. They never made you sit there and wait for them to come back. They were just tremendous people.